Hello everybody and welcome back to Synapse. This is Ritika and in this video I shall talk about menstrual cycle, which refers to cyclical hormonal changes that occurs in a female after puberty, which has specific effects on the genital tracts, mainly the uterus and rest of the body. Let us first understand about the HPo axis, which is hypothalamus pituitary ovarian axis. The hypothalamus, which is the highest center for hormonal control, produces GnRH, which is gonadotropin releasing hormone, which has effect on pituitary, on the anterior pituitary, and stimulates the production of FSH, that is follicle stimulating hormone, and LH, that is luteinizing hormone. Hypothalamus also produces prolactin inhibitory hormone, which is basically dopamine, which has inhibitory effect on the prolactin synthesis by the posterior pituitary. So this inhibits the production of milk in a woman when it is not required. So this inhibition is lifted off only when lactation is desired. So now this FSH and LH has effect on ovary, which is the next organ in its HPo axis. So what action does it have? FSH helps in follicular maturation. LH helps in ovulation. So we know that LH surge is followed by ovulation for around 24-36 hours. And it also helps in luteinization, that is corpus luteum formation, which further produces progesterone. FSH and LH together has an effect on the ovary, which induces estrogen production. So now this entire cycle, where hypothalamus produces several hormones, which has an effect on the hormones produced by the pituitary, which further has effect on the hormones produced by the ovary and functions of ovary, is called the HPo axis. There's always got to be some feedback mechanism. So the negative feedback mechanism that we're looking at, there's something called the long loop, short loop, and ultra short loop. Long loop refers to the estrogen and progesterone, that is the ovarian hormones, having a negative feedback on the hypothalamus. Short loop is where the FSH and LH has a negative feedback on the hypothalamus. And ultra short loop is where certain substances and factors within the hypothalamus has negative feedback on the hormones released by hypothalamus. Before we get into the actual cycle, let us understand the functions of estrogen and progesterone, starting with estrogen. So it has effect on the secondary sexual characteristics development, the development of the vulva, cornification of the vaginal epithelium. On uterus, estrogen has the effects which leads to proliferation of the endometrium, there's myohyperplasia. The spiral arteries in the uterus become straight and get stretched. On breast, it has effect of enlargement and leads to ductal and parenchymal hyperplasia. But remember, estrogen does not cause lactation. Indeed, increased amount of estrogen inhibits lactation. It also has effect on the bone, that is, it increases calcification of bones, which is why after menopause, because the estrogen levels drop, women are more predisposed to osteoporosis. On lipid profile, it has a good effect, that is, it increases HDL, decreases cholesterol. Progesterone causes secretory hypertrophy of the endometrium of uterus, leads to tortuous spiral artery, also causes decidualization of the endometrium, and it helps in maintaining the pregnancy. Effect on cervix includes hypertrophy of the cervix, and the secretions from the cervix becomes tenacious. And both of these effects on cervix helps to maintain the conceptus within the uterus until it is time for expelling it. On breast, it causes enlargement of the breast, and the effect on temperature is that it raises the temperature by 0.5 degrees Celsius above the basal body temperature. And it helps in relaxation of the smooth muscles, that is, it helps in relaxation of the uterine muscles, which helps in stretching of the muscles during the pregnancy. Let us now look at the cycle per se. So there are 4 different cycles that I'm going to discuss over here. One is the changes in the pituitary hormones. Then you have the hormonal cycle, which is the ovarian hormone cycle. the ovarian cycle, and the endometrial cycle and correlate all of them. Starting with the pituitary hormones. So we're seeing that the FSH initially has a small peak. FSH has a small peak around 9th day and it has a post-ovulatory peak again. LH goes on increasing throughout the cycle, that is starting from the day 1 or day 0 of the cycle, it goes on increasing and there is a LH surge or a peak which is followed by ovulation in the ovarian cycle. And then it goes on decreasing. The increasing LH and the FSH has an effect on the estrogen through the first half of the cycle, so it increases. Progesterone, because of the corpus luteum formation following the LH surge, progesterone increases because the main source of progesterone here is the corpus luteum. Looking at the ovarian cycle, the increasing level of again FSH and the LH causes maturation of the ovarian follicle, so it is maturing into a Graafian follicle. The LH surge is leading to the ovulation, so release of the ovum is occurring over here, which is followed by corpus luteum formation. Let us now look at the endometrial cycle. The increasing estrogen leads to proliferation of the endometrium, where the spiral arteries are straight and stretched. Following the ovulation, the increasing progesterone level leads to secretory proliferation of the endometrium, where the spiral arteries are tortuous. And when fertilization of the egg does not occur, the corpus luteum degenerates, the progesterone falls down again, then the cycle starts again, that is menstruation occurs because the lack of progesterone cannot maintain the thick endometrium anymore and the endometrium sheds off. And the cycle continues. So this is how you integrate the levels or the changes in the levels of your pituitary hormones, your hormonal cycle, ovarian cycle, and the endometrium cycle. That's all in this video. I hope you found this brief explanation of the entire cycle and correlation very useful, and I hope you could revise all your concepts over here and correlate different cycles and what exactly happens with the hormones and the endometrium altogether. If you found it useful, like the video, share the video, and subscribe to our channel if you haven't already. And you could leave in your video suggestions in the comment section so that we'll make videos on that. And bye-bye until the next time.